Namaste and welcome to the session on principles and methods of student assessment with focus for PAHS academic programs. The objectives for the sessions are as follows. The purpose of student assessment can be listed broadly as follows. There are four lists. The first one is to make judgment about the level of skills and knowledge. Then we want to improve the students' knowledge and skills over time with feedback. Then we want to evaluate the strength and weaknesses of the assessment tools that we have been using. And sometimes we also want to rank the students to motivate them. Basically, student assessment can be divided broadly into three parts. One is diagnostic, another one is formative, and the last one is the summative one. Diagnostic is done before the class so that we can know where our students are in terms of our class content or the course, so that we can prepare our class effectively. Formative assessment is done usually during the class. This is where we help our students to achieve the goals and certify the competencies. Summative assessment is the one where we want to assess the mastery of the course. Say at the end of the course, end of the module, end of the block, using the summative assessment principles. As you know, assessment drives learning. So if you want to change the learning habit on your students, the assessment should be changed. Similarly, assessment actually fills the gap in learning and curriculum. There are some criteria given by international educators on how assessment can become an effective assessment. So let's look at that. The criteria number one is clearly defined measurable learning outcomes or objectives. This is extremely important because assessment cannot be done in a vacuum. We have to have objectives, and that is normally seen in the syllabus of discipline. And when the syllabus is compiled, it becomes a curriculum. Okay, so we have to have a curriculum for that one. So this is something that I want you to think, and we can discuss that in the face-to-face session. So while writing the objectives, we must think about the 5 basic elements, who the objectives for, what they will do. We have to use the action verb here, and how much or how well we want them to do that. And then we have to think about of what the tasks, and then by when the time should be given. So these are the 5 basic elements we have to use while writing the objectives. These are actually derived from the Bloom's taxonomy, which came out in 1956 from Benjamin Bloom, who is an educator, who was an educator. So he actually divided the cognitive domain, the knowledge, into 6 different levels. So he said learning can be a rote learning, which is the base of this pyramid, and the highest level is evaluation. He has also given us the action verbs that can be used for these 6 different stages of knowledge assessment. He has also given the skill verbs that we can use while writing out skill objectives. Writing objectives, this is an example. For example, in this session, I can write each participant will enumerate all 5 basic elements of an objective at the end of this lecture. So this is a simple knowledge objective. And in order to assess this objective, I can either use multiple choice question or short answer question with you all. The second example is each undergraduate student determined by palpation to an accuracy of plus minus 0.5 centimeter liver size in a child at the end of the clinic when he is in the rotation there. Okay. So this can be done using the observation, and the tools that can be used for this one is mini clinical evaluation exercise, directly observed procedural skills, and OSCE. The last example is each student will summarize at least once in PBL discussion during a PBL case. So we want to promote the habit of summarizing the discussion. So this can be done using the observation checklist, which we use in the basic science in the MBBS curriculum and BSc and BNS program in the nursing curriculum. So this picture tells us that if learning objectives, teaching learning methods, and assessment are aligned, then it is called curriculum alignment. But when they are not aligned, then that is called a curriculum mismatch, and that is what we want to avoid. So kindly think about it and do not make the mistakes of curriculum mismatch. The second criteria of effective assessment is the representative sampling of performance. This is actually done using the tool called blueprinting. Okay, so we have to have exam blueprint because without that we will never achieve the validity of the exam. So this is an example for you to think. This is another exam that we use in the MBBS program. So this is the integrated exam OSCE blueprint. The third criteria is we have to use a variety of assessment methods because each and every assessment method has its own advantages and limitations. So one method is not good for doing all the assessments. The famous Miller pyramid was modified by McGuire in 1999, and he actually gave us some tools. For example, to assess the basic rote knowledge, we can use the classical MCQs, the essay question, and the oral examination. But if we want to assess the understanding, then we have to move higher with MCQs with clinical vignette. That is what we use at PAHS. The extended matching items, that is a new one that is used in the PG assessment. The key feature test, which is very similar to our PBQs. Structure essays and oral examination. Structure both. Structure essay as well as structure oral examination can be done here. So if we move one step higher after acquiring the knowledge, then we can do this skill test in the simulated environment. The example of that test will be the OSCE, the short case, and the long case. Then we want to do an authentic assessment with the student in the real setting, maybe in the busy clinic, maybe in the inpatient, or outpatient, or even in the emergency. So that is where we can use the workplace-based assessment. These are the tools that can be used there. So as we move up in this pyramid, because of the authenticity increases, the validity also increases. And this is something that we want to do. The fourth criteria is we have to use a uniform test and procedures for all. So we have to standardize our test as far as possible. Okay, so because if we do not do that, then our students will be penalized, and we really don't want to do that. And this is one of the reasons that we don't use long case in the MBBS curriculum of PAHS. This ensures the reliability, which in turn gives us the evidence for validity. And this is a very important point to ponder on. So what we want is the what is shown in the figure 3. We want our assessment to be reliable as well as valid. So this is an example collated from the literature. So if you see the slide, the key feature test or the problem-based question and the OSCE test are the extremely reliable and valid tests because they are very much standardized. Multiple choice questions are also very good in terms of reliability, but the validity depends on whether it was discussed before using in the exam or not. Similar argument is also there for essay questions and oral exam. Actually, oral exam does not have any reliability because we ask different questions to different students. The validity is very high because we want we can modify or tweak the questions as per the student that we are taking the oral exam. The fifth criteria is we have to have an explicit, specific criteria in judging and grading the successful performance. So if you remember the essay questions, if they do not have a model answer, then it will become extremely difficult to uh, assess and give the same marks to all the students. So we have to have keys and model answers. But apart from that, what we also need to have is standard setting. And this is something that we have been using in past, using a modified Angoff method, especially in the multiple choice questions. So this is one of the question that you can think about it. The sixth criteria is the whatever we have said earlier, the recommendation is that those things should be feasible in our institute. So if it's not feasible, then we cannot use it. So Professor Van der Bruten from Maastricht University has given us this formula. Utility of assessment is related to objectivity, reliability, validity, feasibility, relevance, impact, and cost effectiveness. And if one of them is not up to the par, or let's say if it is a 0, then whole utility becomes a 0. The seventh and the last criteria is timely feedback. The recommendation is it is not sufficient to give feedback, but it should be given on time. So Zubair Amin, a pediatrician from National University of Singapore, has divided the assessment into 3 parts: low stake, medium stake, and high stake. So low stake is a formative. It is a self-assessment or diagnostic assessment where students are not scored but only given as a self-assessment. They can do it on their own. And that type of assessment serves as a diagnostic assessment for us, for the teacher, so that we can modify our session. The second one is the continuous assessment or internal assessment that we all know. The final one is the professional assessment or the summative assessment. Recently, from 1990s, there was a change in the assessment and the curriculum. The competency-based medical education started in Canada, then in USA from 1990s, and it actually was implemented until 2010. It is still implemented in many places. But while implementing, CBME was found to be very difficult to implement because we were heavily using the tools for that, using the milestones. But then in 2005, a Dutch educator called Ole ten Cate, he invented this EPA, and this has changed the game now for the CBME, because we can actually assess the different competencies using a single EPA. So this is the beauty of EPA, where one EPA can assess multiple competencies that we have laid down in our program by the institute. This is an example of once we have defined the EPA, then we also need to work on the program of assessment. And this is an example from a colleague, physiology faculty from India. She has devised her EPA in 3 different phases. So preclinical phase is basic science, clinical is clinical phase, and intensive phase. So if you see here, the written test is there, the skill test is there, and even the workplace-based assessment is there. Multi-source feedback is also given in the intensive phase. And introsment-based discussion means the high level of this oral exam based on the portfolio is also done here. So this is all from my side. So thank you for your patience, and I will see you all in the face-to-face session. Thank you.